All right, it is recording.
All right, I'm JC.
And I'm Caitlin.
We're going to talk about the social determinants of health in the article that we were supposed to read for this week. And I
Yeah.
think the first thing to point out is that health gap between the socioeconomic classes. And the author pointed out that even though health has gotten better as a whole throughout time, the gap has stayed the same, and there hasn't been any change in that respect.
And the people with lower socioeconomic statuses are more likely to die premature deaths and live a worse life than people with a higher socioeconomic status. And that coincides with like lower education. Like if you have a lower education level, you're more likely to die earlier than if you have a higher education level.
Because I think it was important when the article pointed out that people in higher socioeconomic classes live longer lives, but not only that, they live longer, healthier lives with less time with a disability. When people in the lower classes live shorter lives on disability. So their quality of life is something important to look at as well.
Yeah. And the author talked about like how doctors normally, when they are trying to like decrease this gap, they just try to have their patients like not partake in risky behaviors, but a lot of the risky behaviors, yes, you can fix, you can stop, but a lot of them you can't. Like you don't choose to be poor, so that's something you can't overcome, as opposed to like smoking.
And I feel like as a physician, it's very hard to look at those people and not speak to them as if they were poor.
Mm-hmm.
You know what I'm saying? Like they speak to them in a way like don't do this and don't do that, but they don't look at it in a broad perspective as like why they do those things
Mm-hmm.
and
And
why
I think
they wouldn't.
that coincides with the question in the module about the person-centered care.
Mm-hmm.
Why I thought this kind of coincided with, because you need to know like their background and like how you can help them based on their lives.
Yeah, it's very important to get a view of the whole person and what factors in their life are leading to them to these behaviors. Because I really liked in the article when they went through a list of risky behaviors and telling them not to do this and to do this and have a healthier lifestyle and get exercise. But then they contrasted that and said that there were limitations to that list and that the true list should be don't be poor. If you can, then stop being poor. And those are things that are completely out of their control in many different ways. Mm-hmm. So it's going to take effort from other people outside of those statuses to make those changes as well.
Yeah. And the author, her list of what like would best help, I thought was really interesting. I thought it's difficult to put in place, definitely, and it would take a lot of work, but like training the medical professionals and reducing the psychosocial like risks with not just doctors and nurses, but with everyone, like lab techs and all of them, to make it a better place to work, and so they can focus more on decreasing this gap.
Yeah, I think one of the biggest changes that could be made though is using education for these people, like trying to find a way so that education is accessible to all of these people. Because if you have an education, you're more likely to get a better job. Therefore, you won't be in this situation where, number one, if you can stop being poor, then stop.
Yeah.
And I feel like that's the first step. And that's something that could really bridge that gap.
Yeah. And even like decreasing the like social stigmas that come with it. Like if you're this nationality, then you must be poor or this or that.
Yeah.
Like decreasing that and really like encouraging like people in like these communities, these minority communities, to like, so we can decrease this gap, like the Aboriginal community that talked about at the very end, how they like really uplift everybody and they have a smaller gap.
Because the problem with those stigmas, if you tell these people over and over and over again that if you're this nationality, you must be this, then that's what you start to believe, whether you want to or not. and then that's the position you're in.
Mm-hmm.
No, one other thing that I found was super interesting was at the very end when they talked about advocacy, and they almost talked about working together to make this change. And like I said earlier, it's going to take efforts from everybody, not just the lower socioeconomic communities, to make this change because they can't do it on their own.
Yes.
And he called it his fantasy land. He made it sound like a civil rights movement, which really it is.
Mm-hmm.
Because these people should have access to healthcare too, and good healthcare and healthy lives. You just have to believe that it can happen.
Mm-hmm. And this is definitely something that's happening right now, and it's very prevalent right now.
Yeah, so I think saying that it's like a civil rights act is very true. I don't know how else to explain it.
Yeah.
But I think that's all I have.
Say.